So as we all know, CT surgery is one of the most competitive, demanding specialties, and navigating this path as an IMG comes with its own unique set of challenges and opportunities. So today we have an incredible group of residents and also faculty experts who have firsthand experience and invaluable insights to share on this topic. And our goal is to basically provide you with practical advice, inspiration, and deeper understanding of what it takes to sort of succeed in this field from this background. So we really encourage you all to engage actively, ask questions, take full advantage of this opportunity to really learn directly from those who have walked this path before you. So without further ado, let's really dive in and hear from our distinguished panelists. And so I think we'll start off first with our 5 to 10 minute presentation from Dr. Yazdici. Once he's ready.
Yes. Yes, I just wondering how I can log in from this computer to share the
The screen.
screen.
Okay. In the interim, I'll just read a short bio that he sent over to us. So Dr. Yazdici is the director of aortic surgery at Jackson Heart Institute in Miami, Florida. He earned his medical degree at the Shahid Bahishti University of Medical Sciences in Tehran, Iran.
Yeah.
He then earned a Master's of Science degree in clinical research from Case Western Reserve University / Cleveland Clinic, Ohio. Dr. Yazdici completed his residency in cardiothoracic surgery at the Brigham and Women's Hospital and a fellowship in advanced aortic surgery at the University of Michigan. He specializes in adult cardiac surgery for thoracic aortic aneurysms and dissection, including endovascular treatment. Dr. Yazdici also performs aortic valve repair and replacement, including minimally invasive and percutaneous treatment, aortic root reconstruction, and high-risk reoperation surgery. And so without further ado, once you're ready, we can begin with your presentation.
Okay, great. Yes, I switched screens and let me see if I can share this. Hi, everybody. Sure. What can you guys see?
We can see your slides in addition to your notes.
In addition to what?
Your notes. So click to add notes. It's like the slides are it's an up left corner for me.
Okay. So is it in the presentation mode?
No, it's not. I don't think so.
Oh. So you can see two slides
I think you
basically.
can click
Yeah, I
the
can see
swap
two slides.
displays.
Say it again.
I think you can click the swap displays on the left upper corner or something like that.
Swap displays the third icon.
Okay, yeah. Oh, great.
There you go.
Okay. So sorry, I only have like 10 minutes. I need to go back to the operating room, but I was invited to join this forum because I'm a pharmaceutical graduate. So I was born and raised in Iran, and I went to the medical school over there, one of the top medical schools. But I always wanted to become a cardiac surgeon, and I came to the United States. So my journey started in Cleveland. It's I did 2 years of general surgery. That's what I matched first, and then I got an NHLBI clinical research scholarship. And through that, I got a master's degree from Case Western, and I did some research with the Cleveland Clinic cardiac surgeons under the leadership of Gene Blackstone, who is a very well-known cardiac surgery researcher. And that, so to speak, set me up to come to Boston for my cardiothoracic surgery residency in an I6 program. That didn't come easy though. I did another year of general surgery preliminary over there and some cardiac surgery fellowship. And, kind of showed people how I want to do this. And I got into the I6 program over there. And that included doing some research in the middle that was mandatory. And also I did the structural heart fellowship over there. And after I graduated, I went to Ann Arbor, Michigan to do an advanced aortic surgery fellowship. So I made it, is the point, and it's possible. But I think that we need to have a plan. If you guys are or like a biomedical student really wants to do it, you need to keep your eyes open. I think make your resume really strong and keep your options open. So the I6 residency, this is one of my medical students, kindly um, extracted this data from the NRMP papers or database. So as you can see, the percentage of the match for the non-US citizen, IMGs are not that high. So 2.7%, 8% some years, 10%, and then 3.7%. This last year, 2024 apparently was 0%, which is hard to believe, but and then when you go look at the traditional fellowship, so the percentage of IMGs matching is higher. So that, tells me that, yes, I6 I think is a good path to become a cardiac surgeon. You're more focused, you do some cardiology rotations, and you become a better heart surgeon at the beginning. But the traditional fellowship, like 5 years of general surgery plus 2 years of cardiothoracic surgery, may give you a better chance. So, I would encourage you to apply to general surgery and make your resume strong for the general surgery as well, as a backup. And this is the preliminary general surgery. Like I said, I myself started as a preliminary general surgery resident, and the percentage of matching for those is relatively, okay. So last year, 1/5 of them were IMGs. And that's good because, that is an opportunity for you to get into the system and show how good of a doctor or surgeon you would be. And then that way, people will count on you more. And the next one is like the general surgery match categorical, which is also low, but again, for the IMGs, I mean, this, recent years, but I mean, if you get into that, then the chances of getting into the cardiothoracic surgery was higher. So these were some data, yeah, and also my story. So I think what matters is, if you really want it, and then have a plan, and one of the most important things that I had was like good mentors. You need to find mentors that you think that will lift you up and prove to them that you're worthy of, like, their mentorship, and and uh and I think you'll go places if that's what you really want to do. So I'm happy to answer any questions or any, I don't know if this was any helpful or no, but
Yes, this was incredibly helpful. Thank you so much for such a thorough presentation, really putting out the high yield data that we need to know to understand what the landscape looks like at this present moment, especially when looking at the match results, fellowship results, and just being able to understand what those stats actually look like. If anyone has a question or comment or concern, feel free to drop it in the chat or to go on mute. Again, not all at once, but just as we have him here as for the few minutes that we do have him, we really want to take advantage of this opportunity.
do you think there's a benefit to being a US IMG in matching in an I6? So I had a friend who, so I did my I6 residency at the Brigham, and I had another friend who was US IMG, and he matched, the next year. So it actually, some of these, graphs showed that, the non-US IMGs did better. but I don't exactly know what the denominator is. Maybe there's not many US IMGs, but yeah, I mean, you know the language, you know, your English is probably better, and you have some roots, and it matters. Like when you apply to a program that, you know, you say that, okay, I want to come to Boston because, you know, my family lives in Boston, and so people, you know, may give some advantage to that. However, I mean, this is, you know, theoretical that I'm thinking and I've seen, but I don't have any robust data to say any difference between US or non-US IMGs. I think it's just the medical school, like most of these programs, when they want to screen the applicants, they look at the medical school that they know. But the medical school like mine, who you don't know, so they may not, like, you know, dive into your into your application as much. So I think that matters more than US or non-US. So that's, you know, when you have to prove that, okay, this is me, this is how I work, this is how I publish, this is how I, you know, handle things. And then, you know, based on that, they may give you the opportunity, but they don't know your medical school. So that's, I think that is one thing that they can't trust. Any other question? Oh, yeah, there are a bunch here.
In the chat, yeah. And feel free to answer as many as you can. For
Okay.
sure.
Yeah, so there was some recommendations, and yeah, so the things that can make you, you know, more competitive. So it's not something that, so I think you need to spend at least 3 to 4 years after medical school to invest for this, do some research, publish, do some preliminary surgery. So I highly doubt it that you'd match, you know, immediately. So yes, the research, you know, the preliminary positions, these are the things that you can do to kind of get yourself in the game. Yeah, and then finding a mentor. I mean, so for me, it was like, you know, when I was in general surgery, I was lucky that I was in Cleveland Clinic, and there were a lot of, you know, well-known cardiac surgeons over there that I approached them, and kind of, it kind of started like that way for me. But yeah, whichever hospital or city that you are, you need to kind of try to network and see who you can, you know, who can be your mentor. Um, no, it's hard to prioritize I6 over general surgery. It's just like I6 is like extremely hard. It's like, you know, the chances of like winning a lottery maybe higher because, you know, it's just like the number of spots. But the good thing is, as one in these graphs that I showed, the number of programs had increased. So in 2017, there was 37 programs. Now it's like 54 programs. And each program usually gets 1 or 2 applicants matched. So it's I mean, I would do my best to become, you know, very competitive for it, but I would not put all my, you know, money in that bank. So I think you need to be a good candidate for a general surgery spot in the same match as well. So, and again, it's not going to happen within a year or two. For me, it took like 4 or 5 years to do the preliminaries, to do the research, to get a master's degree, and kind of, you know, make myself competitive. The results are good. I'm happy, very, very, very happy now, and I think it was worth it, all the pain that you go through. But you also need to be wise and know who you're doing research with, is your mentor, and how you're approaching strategically to get matched. No, there's not much of a difference between the skills now, especially nowadays. If anything, I think, there's all this, question that whether or not I6 residents are as strong as traditional residents because they've done 5 years of general surgery already. Yeah, but the I6 residents will catch up and they'll have, some, transcatheter skills that the, general surgery residents may not have, and they know, how to navigate into cath lab, or they know how to read the echoes and their hands. If you're being trained in a good program with high volume, I think that would not be a concern. So you'll operate and operate and operate, and you will catch up with the skills. Now, you may need a fellowship. At the end, like myself, I didn't needed it, but I wanted to do aortic work, so, and I'm very happy that I did. You never regret doing more training in good programs. So I think that's a good thing. So never try to go get a job just for 1 year if you think that you can, add to your skills just by doing another year of, fellowship. All right, guys, it's a pleasure, but sorry, I planned to kind of attend the full hour, but unfortunately, I have to go back to the operating room right now. But I wish you all best of luck, and feel free to reach out to me if I can do anything or give any advice.
Thank you so much for your time. Truly, this was.
Thank you for inviting me. I appreciate you.
Thank you.
All right. Hey, Yoji, I just saw you. Yeah, Yoji turned his camera on and off for a second. Hey, what's going on? He
How you-
was the chief resident in Michigan right now, where I was doing my fellowship last year. All right, guys.
Thank you.
Good to see you. Oh, bye.
Bye. All right. With that, I guess we'll start with the second half of this meeting. And so I want to take a moment to sort of acknowledge all of our 3 other panelists who are going to be here with us this evening, basically sharing their experiences and their stories as to how they got to where they are today. And so I kind of want to give the floor to each of them to sort of talk more about themselves, their journeys, and how they were able to sort of apply through and move through this period, basically. So feel free to unmute yourself, introduce yourself, and talk about your journey. Whoever's ready.
I think I'm gonna go first. So I'm Yujiro Yokoyama. I'm a second year thoracic fellow at University of Michigan Hospital. And I originate from Japan and graduated from med school in Japan and did some training. And then I moved here in 2018 and started general surgery residency in Pennsylvania. Then after 5 years, then I matched to the University of Michigan for the cardiac surgery, thoracic surgery. Then I'm finishing up the fellowship.
I can go next. I'm Büşra Cangit. I'm from Turkey. I did my medical school in Istanbul. And first I started at Mayo as a postdoc research fellow, and I finished my master's over there. And I stayed for prelim general surgery year. Then I transferred to Mount Sinai, New York to do my cardiac imaging training, which is a little bit unusual. So now I am finishing my cardiothoracic imaging. I took my board certification and everything, and I matched this year to Mount Sinai I6 program.
I can go next. My name is Mahnur Imran. I'm from Pakistan. I moved here in 2018. I first did a postdoc research fellowship at Yale in aortic surgery, and then I did a preliminary general surgery year at Yale, and then I matched into the I6 program at UPMC, and I'm in my 5th year, and I'm going to start my chief year in a month.
Thank you so much for taking the time to introduce yourselves. And so we're going to start off with a couple of questions that are already preset. And so I'm going to ask all of you, and then we'll open up for Q&A to the whole team, to everyone on the call. And so the first question that I have here is, can you share the most unexpected challenge that you faced as an IMG applying into CT surgery and how you overcame that?
I'm gonna go first. So when I applied to the general surgery residency, I think I was PGY 6 or 7. Then I felt like it's really hard if you pass like a PGY 5, and basically you don't get invite from anywhere. So I think that's the most difficult thing. I think you should have some connection to certain programs or a surgeon, but I didn't have any because I was in Japan. So that's the hardest thing. But once you have some get actually invited and talk to them, then you have some chance. But getting the invitation is the hardest part for the IMG.
I think I agree. Getting your foot in the door is the hardest part because, most IMGs are, hard workers, have good scores, have great CVs. But like Dr. Yachi mentioned, our applications don't get looked at because of our countries and our medical schools. So getting your foot in the door. So all the stuff that we do, like the research fellowships and general surgery residency and ICU fellowships, are things that we do to get our foot in the door. Because it's really hard to get mentorship and network in the United States if you're not from the United States. So yeah, getting started is the hardest part.
Yeah, I agree. I think it's a similar, as we talked before, I think at least 3-4 years, either research fellow or preliminary year, we have to do after medical school. I have, for example, one friend from Turkey. He matched directly to categorical general surgery spot, but he spent 4 or 5 years as a postdoc research fellow and did a master's. So versus me, I started as a prelim year and started a bit earlier. So yeah, I think it's hard to get into the system, I believe.
That being said, in your experience, what would you say are the top 3 qualities or skills that you recommend an IMG cultivate to stand out in the highly competitive application process for CT surgery?
I think like CT surgery I6 residency is one of the most competitive like field right now. So it's really hard, I think, unless you actually do the research for a few years at some like institution. It's really difficult. So I think general surgery residency is more open to IMGs. Then actually, once you get in the residency, then you work hard and you do like a research, like a study for upside. And there are many things you can do to match to the thoracic surgery fellowship, like in a good place. So yeah, for me, it was impossible for me to like match into the I6 residency. So general surgery is I think still a good pathway to become a cardiac surgeon.
I think networking is top 3 for me, like networking. I wouldn't have matched into an I6 program if people hadn't made phone calls for me because nobody knew me. And I matched in 2020. So there were 38 spots at that time and 4 IMGs matched. So it's almost impossible to match into an I6 program because there are just not that many positions. There are 258 spots now, but they get 2,000 to 3,000 applicants and they're like the top tier applicants. So if someone isn't making phone calls for you or is not like vouching for you and you don't have mentors supporting you, then it's almost impossible. And the way to get mentors in the US is by doing other things. For example, I did a postdoctoral fellowship, I did a preliminary year at Yale, and all my attendings at Yale made phone calls for me. So that's really why I matched. And again, like general surgery and then doing a fellowship in CT surgery is an excellent route and probably more accessible just because like if there's 55 people in this talk, there are 58 spots in the country. If every single person's applying next year, everyone won't match into I6. So general surgery is an excellent route. Like all of our attendings trained to the general surgery route.
Yeah, I agree. General surgery is definitely more accessible. For example, my mistake, I feel like I was always focused on cardiac surgery. And before I came to ES, I didn't realize that I6, matching the I6 program is going to be this hard. So that's why all my letters and everything was more focused on cardiac surgery, which was, I think, wrong. So I should have like focused maybe or do a little bit more research in other subspecialties in general surgery and try to maximize my CV for gen surg as well. So I believe one of the reasons maybe that's why I started as a prelim and not categorical. And after the prelim year, as other panelists mentioned, so all the IMGs are doing research. They have like, especially right now, I'm like seeing all these other applicants. Everybody has like more than 50, 60 publications. So everybody's competitive. Everybody has masters. So I mean, doing postdoc research fellow is also not enough. So definitely connections helps a lot. For me also, I feel like at Mount Sinai, a couple of my mentors, they really helped me for other programs to get an interview from other programs, as well as staying at Mount Sinai as well. And also, it was a little bit kind of by luck, but getting into this cardiac imaging, I think, I don't know, I felt like this year it played a significant like role in my application, because in almost every interview I get a questions about cardiac imaging, because it was kind of interesting for people. Yeah, I think networking and that, for me specifically, the imaging portion helped a lot this year.
That's really great to hear. Thank you so much for being so candid and vulnerable with your responses. On that note too, if you had to redo your journey as seen in the chat here, is there anything that you would want to change or do differently to improve or shorten your path?
So for me, like I'm pretty happy now that I doing the training in Michigan. So yeah, I'm pretty happy right now. So I wouldn't change anything.
Yeah, I agree. I think I got pretty lucky. I mean, I just did 1.5 years of research and 1 year of prelim, and I matched into I6, and I'm going to graduate in a year. So I'm, very happy, very lucky. I matched with a great program. I feel like my skills have prepared me to graduate soon. So yeah, I don't think I would change anything. I think you just kind of have to roll with whatever cards you're dealt and make the most of it. And I mean, I didn't even know about I6 programs when I moved to the US. My goal was to do surgery. I liked cardiac surgery, but it wasn't like I wasn't gung-ho about cardiac surgery. But when I did my postdoc in aortic surgery, I did my prelim year, I kind of like did the process of elimination and realized I really liked cardiac surgery. And then my mentors encouraged me to apply to I6, and I need a visa. So I only applied to 9 programs of all the ones that were open, because the others didn't sponsor visas at that time. So, I mean, I matched into one of the 9. So I'm very happy with where I've ended up.
Yeah, same. I'm happy that this year it worked out finally. But yeah, only one suggestion, as I said, like I can repeat what I said, but I think it's better to make a plan B for general surgery and get a letters from non-cardiac surgeons as well, just to be prepared.
Thank you. I got a private message from one of the people in the audience. Could you is there any advice on how that you guys got your foot in the door and how you were able to sort of obtain a research position? Was it paid? Was it unpaid? What was that dynamic like?
I can talk about mine a little bit. I did electives in the US when I was in medical school in Pakistan, and the reason for that was because I knew I wanted to train here. And when I came here it's like sub-Is for IMGs. So when I came here for my sub-I, I didn't get one in surgery at Yale. I got it in neuroradiology, which I found extremely boring and was like extremely depressed my entire time I was here. But I reached out to cardiac surgeons while I was here, and one of them had a really busy aortic like research lab. And I spoke to him, like had an interview with him before I left, and told him that I was really interested in surgery and would like to work with him, and kind of set something up before I left. And I didn't actually end up coming back for another year because I graduated, I took my steps, and he still had a position available. So I think any opportunity you get, like while you're in the US, if you're doing observerships or sub-Is, reach out, even if you're not in the department you want to be in. Find out people who have labs. Most people offer postdoc positions. The one that when I started, it was unpaid, but a lot of them are paid. You just need to see who has busy labs, because a lot of them need researchers. And you can even start off as like a research assistant and then work your way up. Or if you're in your home country, just kind of like offer to work with them, like do data collection and do something small, and then like work your way into getting like an actual paid position before you come to the US. But most of the people that I know, a lot of my med school colleagues also did postdocs, and they just cold email people. Like they looked up the departments they wanted to work in, with the fields they wanted to work in, and just like mass emailed people. And I think a lot of those also get you positions.
For me, similar. I did my sub-I elective at UT, and when I was there, I talked to one of my mentor. So then I told them I'm going to graduate. I want to come back as a research fellow, and initially they accepted. But then I went back to Turkey, and then I received an email from HR that there was some issue with my visa, so they didn't sponsor. So then I had to just email. I sent maybe hundreds of email until I graduate. And one of my Turkish professor from medical school connect me with one of the mentors at Mayo. And then through him, I found a position. I started in the basic science lab first. I was working on on mice, atherosclerotic disease and in general. And then after 1 year, I transitioned to clinical research. But yeah, like I sent hundreds of emails.
Yeah, I didn't do the research or any rotation before starting the residency. So
Would you say it's advisable to start with the prelim gen surgery like rotation, or to go through the research fellowship route first, to anyone who's able to speak on that?
yeah, I think like some people can get like a categorical position from the start, but most of the IMG start with the prelim. I started with the prelim, then became a categorical. So I think like and also if you do the research for a year, there's no guarantee that you can get the categorical next year. So for like, I think I definitely recommend starting the prelim gen surg. And I knew several Japanese surgeons who did the prelim, and almost everyone became the categorical within 2 years. So
Yeah, I would say I never advise anybody to like aim for a prelim position or aim for a research position. I think if you have, the main limiting factor for people is applications are expensive. So like if you're applying for a cycle once, it's going to cost a lot of money, and interviews were virtual for a while, which was cheaper, but you have to be in the US, you have to travel for interviews. And then if you don't match, you have to apply again and spend all that money again. So you want to make your application as strong as you can when you apply, but there's no harm in applying more than once. So if you feel like you're a really strong candidate right out of med school and you've got some like good US clinical experience, you have good letters, you have some networks, go ahead, apply for a categorical position, and then always aim for categorical. Prelim positions are your backup positions, because like when you apply for a residency, you can click categorical and prelim for every single department you apply to. I think the first cycle I applied to like 186 programs, which was like all the programs that would accept my application. So apply broadly, apply to prelim and categorical, and your goal is to match categorical because like that's your ultimate goal that you want to get into training. And if you don't match, it's okay. I didn't match the first time, I did prelim, and then I matched the second time. And have like a research position available as a backup, meaning start emailing people and tell them like you're available. And if you match, great. If you don't match, then you have a backup. So like have a plan A, B, and C. When I came here for research, I knew I was going to apply for the next cycle, but I started in January and I applied in September and then I matched in March. So like I was there for a year and a half, but I was doing my cycle while I was doing my research position. So it was great because I was already in the US, I was working, I was gaining like research experience, I was gaining network. I had something to talk about on my interview trail. I wasn't just sitting at home interviewing. I was actually doing research. So your plan A should be matching categorical. Your plan B should be backup is prelim. And there are enough prelim positions that if you're applying with a competitive application, you should match. And then your plan C should be getting research positions in. And most of the time, if you do a research in a big academic center, they pretty much always take their postdocs for prelim general surgery positions.
Thank you. And there was a question in the chat. What's the difference between prelim and categorical, please?
So categorical is what gets you board certified. So everybody's aim is to get into categorical position. So if you do match categorical general surgery, you'll do the full 5 years clinical training and it'll be eligible to sit for your American boards. If you match into categorical, there's only categorical for I6, but if you match into an integrated CT surgery position, then you'll be eligible to sit for your thoracic surgery boards. Prelim is a 1-year position. Some programs do up to 2 years, PGY 1 and 2, but it's just 1 year training or 2 years of training, and you're not eligible for your board. So it's just like a temporary thing. Most big academic centers have prelims because they need like more people. Essentially, you're basically labor for them. Like you're there, you're filling the spots, you're doing the work for them, but they don't have to like train you and graduate you. So you're there for 1 or 2 years and then you have to leave. And the reason prelims exist in a lot of places because some advanced positions like neuro IR, interventional radiology, anesthesia and stuff do 1 year prelims in like medicine or surgery before they go into their advanced positions. So your aim should never be to be a prelim surgery resident. Your aim should be categorical.
One thing I want to add that I became the categorical at the same hospital. I did the prelim, and also most people I know who became the categorical is that they actually got the categorical position at the same hospital. So if you go to the, I don't know, there's maybe some malignant programs, but if you go to the place that they treat prelim as like the same as categorical, and they look at you, and if you work hard, you like they let you become a categorical. I think, yeah, most place. So
Okay. Awesome. Another question here that I'm seeing is beyond like networking, research, publications, and things of that nature, are there any other aspects of an IMG's application that really help them stand out in front of program directors for CT surgery residencies?
I think your letters of recommendation are really important when applying. The first things people look at when they review applications are your medical school. And then they'll look at your letters and who wrote your letters. So if it's somebody they recognize or if it's a big name, like a big institution they recognize, then those will automatically catch their eye and they'll, be higher up. Like some people like give points to different things in the applicant's application, but so the way to get good letters of recommendation is either get some US clinical experience by doing sub-Is electives in med school, doing research postdocs, or for me, like preliminary general surgery position where like the first year when I applied, I'd done a research. So my letters were from my people I'd done electives with and research with, and you always need one from your department chair in your home institution, so from Pakistan. And then the second year when I applied, all of my letters were from Yale, which like automatically, like everybody in my interview trail talked about the people that had written my letters and that my letters were from Yale. So, and now that I review applicants and I see how my attendings grade applicants, the letters of recommendation play a really, really significant role in everybody's application.
On that same note, how competitive do step scores need to be for an IMG to be considered?
I think highly competitive. Step one is pass fail now. So they're going to be looking at your step two scores. I think the first things that everybody will look at is what your scores are. So if you didn't meet the score criteria, then you're already out of the running. Especially if you're applying for I6, then you're competing with top tier candidates from top tier institutes. So step one, if you took your steps when it was still scored, I think good scores like above 240 at least. And for step two, similar scores, but now the step one's pass fail, people look at step two scores more. So they definitely need to be highly competitive. But that being said, I know people with like okay scores that match into general surgery and then are applying for CT surgery or match into CT surgery. So it doesn't take you out of the running. You may just have to like work on the other aspects of your application more.
There are a couple of questions here. Go ahead.
Oh,
Then-
sorry. I guess I put the question in the chat, but I can ask it now. So
Mhm.
my question was for Dr. I hope I'm pronouncing this right, Dr. Yokoyama. So since you went the gen surge route, what did you do during general surgery that helped you match to your CT fellowship?
So I think it's like a thoracic surgery fellowship is still very competitive, and like match rate is about like 50 to 55%. So you got to do everything you can do during the residency to match to the one with the like best programs. So fortunately, I had experience in Japan, so I got a really good. I worked with the cardiac surgeon at the same hospital, like on the post call day or anytime. Then had a really good relationship, and actually he let me do the ABR or something during my residency. So I got a really good letter, and also I did some like research. I think I wrote like 20 or 30 papers during my residency. Then also, I'm not sure how like we had a in-service exam every year. It's called ABSITE. I don't know it's how important it is, but for the IMG, I think you need to really work hard on that. And I got the really score for every year. So I think like basically you need to do everything. Basically work hard, good letter, do research, and get the high score on the ABSITE.
Thank you.
I think the general theme here is that unfortunately being an IMG just puts you, one rung below your like AMGs, and it kind of lasts until you have your job. And maybe even when you're applying, like I'm applying for jobs right now and I'm on a visa, so my application's looking a little different from my cohort, but you just have to work your hardest and do your best every single aspect. Like you just can't slack. Whether it's when you're in med school, in general surgery, during your training, you have to like do your best on your scores, do the best in research, do the best with getting letters. You just always have to work your hardest in every aspect.
On the same line of visas, there's a question in the chat about saying, will the possibility to match increase for a green card holder?
I think so. I think with the current political climate, it's definitely going to play a role because, for example, currently they're not, they've halted J1 visa interviews temporarily. So I'm pretty sure programs are going to feel And I think in general, when you don't need a visa, it's easier to apply to places because there are more programs. Not every single program sponsors a visa. So you are just more programs are open up to you. 1, 2 programs see you less, there's not really the risk of you not getting your visa or coming. And then 3, getting a job after as well. So I think it definitely helps. But that being said, I'm on a visa and I'm an I-6 resident. So I don't think it means that you're not going to get into a position if you work hard and like eventually you will get there. But yes, having green card or being a US citizen definitely does help.
Also, some of the I-6 programs, they require 2 or 3 years research time in between after 3rd year or so. And if you're on certain type of visa, so you can't take a research year. So that's why a couple of the programs, I remember they emailed me saying that they can't provide a visa. That's why they didn't interview.
Yeah, I agree. I'm on J1 visa, so it's been really hard to find a place. Also, I will have difficulty finding the place that can support my waiver. So yeah, if you can get the green card, that will help you to match into the program. Also, after the finishing your training, you have more like options.
Yeah, on that note of what Bushra said, since I'm on a J1 visa, my program does 2 years of research between 3rd and 4th year, which I wasn't able to do because the J1 visa has a 7-year clinical time limit. So I would have had to switch to a different visa category, which I wasn't able to do. So my program worked it out for me, and I skipped my research years. So I'm actually graduating earlier, which worked out in the end for me, but it does limit the opportunities for you. So there are other visa categories than J1. J1 is just the most commonly sponsored visa. It's sponsored by the ECFMG, which is a commission for foreign medical graduates. And it's the one that most programs support. But if you take your step 3 before you match, then you have the possibility of applying for an H-1B visa, which is an immigrant visa, and then you can get your green card during your residency, and it'll make a lot of your fellowship jobs easier. But not every program supports an H1, but it's definitely something like if you interview at a place that only sponsors the J1 and one that sponsors an H1, I would go to the H1 program, because that'll make your life in the long term much easier. And then you can also do an O1 visa, which is like a visa for extraordinary abilities. And if you did a postdoc or had good research background and have the funds to support it, it helps you get a green card. You get an O1 visa, which is a separate category. And then within a year, you can apply for a green card and apply for a passport. So some of the people that I know in training did that. And I think anything you can do to avoid a J1 visa, you should do, because it definitely has many limitations on it as someone who's gone through training and is now looking for jobs on a J1 visa.
Yeah, for example, I am applying for I apply for O1 right now. I'm in the process. So as she mentioned that you need like a certain number of publications and you need to work with a lawyer and all. It's a bit longer process.
Amazing. I know that we're 8 minutes away from the hour. So I just want to sort of consolidate the last question rather that I have from the chat. And so I see there's a lot of questions just about being able to gain exposure. I know the major talking point very earlier in our panel discussion is being able to get your foot through the door. So beyond just being able to cold call like over 100 different people, different institutions, what other tangible piece of advice can you give to our students or our attendants at this call, and sort of being able to sort of help them really get their voice out there and get the mentorship and support and the sponsorship that they need to sort of help them on that journey as well?
I think one thing to remember is that other people don't know what you're going through or what your goals are. So be very vocal about stuff in terms of like when I was in my preliminary year, there was a question in the chat about this, about what you can do to try and like get more experience with cardiac or like mentorship. And people don't know that people forget that you're a prelim, or that your goal is to apply for categorical, or your goal is to match. So you have to remind them. So I set up interviews like after every rotation in my prelim year. I always set up a meeting with my preceptor and was like, I'm a prelim, I want to match categorical. I'm applying this year. Can you please, do you know anybody? And I did that every single time, like 12 times for my 12 rotations. And a lot of people were like, oh, I didn't even think about it. Oh, I had no idea you were a prelim. Oh, I didn't even know like you were applying. And I did the same like with postdocs, like people are actually very, very willing to be mentor you or make calls for you or support you, but they need to know that you need help. So don't be annoying, but like reach out to them and tell them what you're doing. So like if you're doing research, tell them your goal is to match into surgery, that you're not just here to be a researcher. If you're doing a prelim year, tell them your goal is to match categorical or match cardiac, and tell them like make it life easier. So have a list of programs you're applying to, people at those programs, ask them if they know anybody there. So just be vocal about your journey and like seek help.
Yeah, another thing I want to mention, maybe it was only me, but as a culturally, I wasn't used to, like, for example, in the conferences and all, I was seeing all the American medical students, they are approaching the attendings, they're very comfortable talking to them and all. In Turkey, I don't know, we were more like a little bit distant relationship with our professor. We were like not allowed to talk and all. So that's why I was like, initially it took me some time to get used to the system. I think it's very helpful to go to attend the meetings for cardiac, for example, AATS, SDS. I met like a lot of people during these conferences. Some of them I did have a chance to do a research with them, and then they helped me during the match cycle. So I think it's really important applying to scholarships, trying to attend these conferences, and try to network with the people.
Yeah, so I was in Japan when I applied to residency, so I didn't know anyone, but if you're lucky, you can still get the position. So
I shared my email in the chat because there were a bunch of questions if anyone has any further questions. But yeah, I think luck does have a role to play in all of this.
Yeah, feel free to drop your emails in the chat. I think the last question that I'll give you all is rather if there's any like advice that you give to all of our students on this call, what would it be? It could be a 30-second like pitch or whatever feels comfortable for you based on your experiences and the challenges that you've been faced. So we'd love to hear that.
I think don't give up. You will get to where you need to get to if you work hard enough and kind of stay persistent.
yes, same thing. Like just think about what really you want to do, and if you really want to do the training and like practice in the States, just do whatever it takes and work hard.
Yeah, I completely agree. Just sometimes you just lose your hope, but yeah, just keep going and don't give up, I guess, if you really want to do it.
Those are all words that are so empowering and very inspiring. So thank you so much for sharing, and thank you so much for your time. And thank you to everyone for joining us today for today's panel.